Day.
And I'm Richard Day.
We're both chiropractors.
We've been in practice together for 11 years.
Married for 10.
With 3 beautiful little girls.
We know it's possible to have an exceptional practice that's built around your life.
Because we've done it.
So we've created this podcast,
the Lifestyle Practice Builders Podcast.
We'll interview chiropractors, answer questions, and bring you resources to help build and grow your practice.
So let's get this party started.
Welcome back to the Lifestyle Practice Builders Podcast. I'm your host, Dr. Haley Day, and today I sat down with Dr. Holly A. Tucker. She's a chiropractic physician certified in acupuncture. She's also a certified health education specialist, founder and CEO of Active Family Wellness, and co-host of the ChiroMom Podcast. Her love for healthcare business operations and numbers started nearly 20 years ago, running a medical billing department in college to opening a practice with her spouse, serving in various leadership roles on the state, national, and international levels, and most recently serving as a business coach for women in chiropractic. She practiced in East Tennessee with her husband, Dr. Jude Miller, for 7 years until relocating to the Memphis area. She's mom to kid chefs, Tristan and Noah, who love sharing healthy recipes and nutrition lessons on Instagram. So thank you for tuning in, and let's listen to our conversation. Hi, Holly. Thank you so much for being with us today.
Hello. Yes. Thank you so much for having me.
Yeah, I'm excited to have a talk. We've kind of crossed paths on Facebook quite a few times, I think, and groups and whatnot. And I'm excited to have you on the podcast.
Yes. Thank you so much. I mean, yeah, when I saw, stumbled upon your podcast, and you've got quite a robust podcast, and I'm just surprised that I hadn't found it before, but I'm excited to be here and excited to check out a little bit more about what you and your husband do.
Awesome. We're excited to share your journey in chiropractic. So can you tell us a little bit like where you went to school and what you did after school, what you've been doing since you graduated?
Yep. So this year, actually coming up on my 10th anniversary of graduating from Logan, my husband and I actually met at Logan. He's a chiropractor as well. And for the first, I would say 7-8 years of our careers, we practiced together. We were in a small town in East Tennessee. It's actually his hometown. And we, we're just rocking and rolling. We were building our practice, building our family at that time. And, really didn't know or didn't think that I think small town life was it for us forever for our chiropractic careers. But he got an opportunity about 2 years ago to take a job working for a D1 sports athletic program in partnership with Logan University. So we kind of flipped our lives upside down and entered the new stage of our career. So that's kind of led me to what I am doing now, which is some early career chiropractic coaching and mentoring. And then I also have a side practice on my own.
So we get lots of questions because we're a couple too, a chiropractic couple too. So I'm going to ask you just a couple quick questions about working with your spouse. Did you guys start your practice on your own right out of school?
Yes, we did. Well, we had graduated in August that year, and I actually went and did an internship at the World Health Organization in Geneva, Switzerland. And so that was 3 months. And then he had to wrap up his master's degree. So he did his master's internship during that time. And, probably about a month after graduation, we decided that, I did want to return to the States, and we wanted to open up a practice together. So we opened up in his hometown, and we both kind of like doing things our own way. So we knew we didn't want to take a job or buy somebody else's practice or something like that. So we felt very confident in just opening up, putting your shingle out. And so we did that. We launched in January, I guess, of 2012 is when we opened up our practice.
Okay. Did you guys treat similar patients, or did you each have your own kind of different patient base that you had?
I would say probably for that first year, we were really just taking anybody and everybody that wanted to come in. I mean, literally, he's a morning person. So he was there from like 7 a.m. to 7 p.m. I'm not a morning person, so I came in around 8 or 9 o'clock. But throughout that first year of practice, I actually wrapped up my acupuncture certification. And really, honestly, after getting pregnant with our first child and really just myself, like not feeling physically able to do, the volume that I was doing before and just not feeling comfortable with some of the physical aspects of practice, when I left on maternity leave and I came back, I only came back in the capacity of doing acupuncture. So for the first couple of years of motherhood, it was, practicing part-time and just doing acupuncture until I, really felt able and ready to get back to chiropractic. Yeah, we sort of morphed into working very well together, I think, in him doing a lot of rehab and a lot of hands-on stuff with patients, and I would take more of the holistic approach, with doing acupuncture and doing a lot of nutrition work with our patients. So we independently had our own patients. Sometimes we would co-manage patients for the same thing or for different things. It was a really cool flow we had with each other.
Good. That's awesome. I love to hear that. And I know that our audience loves to hear about successful chiropractic couples that come out and do it well. But today we're going to talk about Profit First approach to finances and accounting. So can you tell us about Profit First and maybe how you discovered it?
Yeah, of course. So I discovered Profit First probably back in like 2017. So, we've been rocking and rolling in practice for 5 or 6 years at that point, and things were going well. It seemed like, every year, paying yourselves a little bit more and kind of getting more in the groove of managing the finances. And that's actually something that I did in the practice. I had experience prior to chiropractic school with doing some bookkeeping and then also doing insurance and billing and that sort of thing. So I came into the practice with that knowledge. And so it's just a natural role for me to take that on. As we, divided up the management of our practice. But it still was like, just a running ticker of things that I had to do all the time. And there really wasn't a system behind it. So I found out about Profit First. So it's a book. It was written back in 2005, but it's a book. And some friends of mine, we were in a mastermind group together at the time, some other women chiropractors. And we decided like, hey, let's implement this. Let's read the book ourselves together. And then let's implement it in our businesses and kind of see what happens. And it just instantly made so much sense to me. I mean, I'm a rule follower anyway. I like to do things literally by the book. So it's like, if he says to do it, I'm doing it all the way. So we did it in the business. And then I also adapted it on our personal finances. But what it is, if you're not familiar with it, is it gets you away from having like maybe just one or two checking accounts for your business, like having your business bank accounts. And you actually open up 5 bank accounts and you name them different things so that there's more intention behind your cash flow. So it is called Profit First because the whole goal is to rid the world of entrepreneurial poverty. So we don't want to, get stuck in this like survival trap of never paying ourselves well as entrepreneurs, or, always kind of chasing that tax trap where we're like on paper, we're trying not to make a lot of money, right? And so our profit is like last, right? So the system turns that around. It says, no, if you want a sustainable business year over year, you have to make a profit. So that's what we do it intentionally with those different bank accounts.
Wow. So were you able to implement Profit First just by reading the book, or did you have to take a seminar? How were you able to do that?
Yeah, just I read the book, and then within our chiropractic coaching group, we had several people that had done it. So it was reaching out to them and seeing if any questions arose or anything like that at that time. And then because I just loved it so much, like I sort of gravitated towards being that person that people asked questions of, after that. So that was a few years ago, and then recently. I really just found that, I always gravitate back towards, let's look at numbers, let's look at stats. When I'm mentoring students, there's just this whole misconception of like, what do we even do to open a business and how do we pay ourselves and that sort of thing. So I've actually pursued joining the Profit First Professional Network and becoming certified in that. So I am in that process right now because out of the book came, this community of CPAs and, financial planners and bookkeepers and then coaches that love the method so much that they wanted to have a structure and a network to be able to, refer clientele to. So I've actually just joined the network and have become their training program.
Okay, cool. So what can you tell us specifically some of the things that really helped you with in your practice?
I think the first thing first and foremost is that it gives you a structure for managing your cash flow as far as like a timeline is concerned. So what happens is, you let, the deposits into your bank account and, twice a month you sit down and that's kind of like your money day or your money date. And you look and you do what we call distribution. So it's all based on percentages. So, rather than like every day trying to remember, well, what was there another bill I had to pay this day? Or, I need to go check the bank account for this, or I need to go see if that cleared. Like it's simplified the fact that, twice a month, I'm going to sit down and those are going to be the distinctive days that I do that. And now some practitioners will actually do it like every week, like say Friday is the good day that they want to do that. And that's completely fine as well. But I think it made it abundantly clear to me and to us of all the money that we were collecting, how much of that, piece of the pie actually came home to us, because it's like we knew, the checks we were writing to ourselves, what our payroll looked like, but we didn't necessarily know that ratio of all the work that we were doing, how much was actually coming home to our family. So the profit first system, because it's based on percentages, it very clearly gives you, how much of that chunk of the pie is coming home to you and how much is going, right out the door to your overhead. And, how can we make the business more efficient and more lean so that we're more intentional with the cash flow?
Okay. So are you using bank account numbers, or are you keeping bookkeeping up to date? And that's what you're using? How are you using?
No. Yeah, you go to the bank and you actually open up 5 different bank accounts. So your first one's called deposits, and that's just literally where all the money comes in, and it's typically a checking account. Your next one is called owner's pay or owner's compensation. Then you have a tax account. So you're intentionally, with, every single month you're dropping money into that tax account. Even if you only pay taxes once a year or once a quarter, it's not great for cash flow to have that, big check come out, right? So we want to put money in there, as a little nest egg for when the taxes are going to come, because they're going to come, right? So, and then you have your last account, which is called your operating expenses. So those, the operating expenses is usually what people think of as like the top line, right? The first thing you have to spend your money on. So this system just flips it to say, no, we need to get really lean and find out what expenses are truly vital for your stage business. And you have to stay, within those parameters. If it's important to you to have a profitable business and to pay yourself well, right? So what I do when I'm working with clients, and what, any profit first professional will do is we're not just going to rip the Band-Aid off, and say, these are the percentages you have to be at, starting tomorrow. What we do is we do an assessment. We're going to be looking at your books, looking at, potentially what your tax liability was, over the last couple of years. And we're going to come up with some rough percentages of where you are now. Even if you didn't have, those different bank accounts open then, we can know what you spent your money on. And so we come up with those percentages and we set up targets to move towards the more ideal percentages based on what your goals are in business. So yeah, you have those 5 bank accounts open. And you just sit down, that twice a month is when you're putting money and you're distributing the money into those other bank accounts to be spent intentionally.
Okay. And I bet that following that system really helped when it came time to selling your practice.
It did, to an extent, because we were so clear on our numbers, and I've, over the years heard lots of stories of, from some of our interns and students that we've mentored that are going out, to try to buy a practice. So well, what should I be asking for? What should I be looking for? And it's like, any entrepreneur can get creative with how much, they value their practice, it's like their baby, that sort of thing. So yeah, it's good to just get down to black and white and let's say, okay, clearly what were operating expenses? What were things that were, you definitely don't want to have any personal and business stuff that's mixed in, but what was something that was more of a benefit to the owner that wouldn't necessarily be something that would pass on to a new owner, those sorts of things.
Right. So what are some other systems that you guys, or tools that you've implemented in practice that have really helped keep overhead low? Because that's something that we really preach, is low overhead, especially with the last year, how it's been, and then also just run more efficiently.
Yeah. So, when I talk about essential business expenses, we want to look at things like, having the right size space for the stage of practice that you're in, or, if you, end up in a situation where maybe you're in a bigger space, just looking at, how much of that space is revenue generating for you, or is there an opportunity where you can, rent some space out to a like-minded provider or something like that. Just sort of looking at, if it's important to you to manage the cash well, then we have to get those expenses down. I really am a fan of things that, make your job easier. So if you can't delegate things to staff, depending on what your staff arrangements look like, then finding software that's going to help you with certain things. We're big fans of ChiroUp in our practices because, it makes the patient more more of an active member in their treatment plan and their therapeutic process. It's giving them, those rehab exercises to take home. And it's a really great platform to work with and also network with other medical providers that you may have referral relationships with. So that's one thing we really like. Using other things like systems like FullScript. Are you familiar with that? Where you don't have an inventory for supplements, but it's something that you can adjunct or add on to a patient's care plan that can help them get better, and that you don't have to manage the inventory and that sort of thing. And that's supplements that are just drop shipped straight to them. So that's one thing when we're simplifying the cash flow. It's like, okay, what is absolutely necessary for you to have in the building versus resources you can tap into.
Yeah, we really like ChiroUp and FullScript. So those are great ones. Has there been anything that you've tried to use or implement that didn't work well?
Good question. I would say, one of the biggest things, one of the biggest expenses, and I don't want to say risks, but it's just something you really have to manage is, your human resources and, hiring people that are going to be right for the position that they're in. And don't be afraid to, set benchmarks for people and also invest in your people and training them up for certain things. And if they're not the right person to do that, then, being able to be nimble and, and move and be able to change and adapt to certain things. I think that for us, hiring out something like a social media campaigns and stuff like that really just didn't work well for us. Because it just wasn't like we were so ingrained at least in our first practice, so ingrained in the community that it's like people knew when things weren't us, right? Because we had been so active, and it's like when we tried to delegate, they're like, okay, let's just have some content, off on social media, kind of take that one thing off of our plate. It just didn't land, the same. So I would say that was one thing that didn't really work well for us.
That's actually something we hear a lot about. And I think it's just so hard to have someone take over something that is so personal. It should be your voice on, the internet. And so to have someone else take it over, it's hard to find that right person. Mm-hmm. So what's your top tip for a new graduate coming out of school?
So I have sort of a baseline assessment that, I help students work through, and you really just try to plan out and map what their generation potential is going to be in their chiropractic career. So, everybody comes from, a different, family of origin as far as it comes with money, mindset, and things around what they, feel that this profession can compensate for them. But I like to break it down for new grads to say, okay, what do you want your desired salary to be? What do you want your ideal schedule to be? Meaning how many weeks, a year are you going to work, and you're going to take time off? Because I think that's really important for your physical and your mental health. And then how many hours a week do you want to work? Because, you can set the ideal and that should be your intention, but, life happens, right? So I know for me, I never really expected, I remember when I graduated, I was so gung-ho to practice, it's I never expected that, after having a baby, I only wanted to come back, part-time. And it was in those first couple of months, it's I don't know if I can ever go back. Obviously you can. But I usually have them, go through that baseline assessment where we set down a salary and we're going to divide out, okay, well, how many hours and how many weeks? And then what does that mean for what's your effective hourly rate? Because it's really hard if they're not used to, especially I came from the background of knowing medical billing and software and that sort of thing. So I knew okay, what are some of these reimbursable codes and, what can be the potential there? But that it just informs how many patients do you want to see per hour? Because all of those ideas and concepts are really nebulous unless you have somebody that's willing to tell you true and honest numbers for what collections can be and that sort of thing.
Yeah, I think it's really important. I think what do I hear you saying is their vision. What's your vision for practice? And then kind of coming up with a business plan with those ideas. And if making sure they align and that you have the realistic picture of where you're going with what you're doing. So I think that's really good. So what about someone who's maybe practicing or been practicing that feels like they're kind of stuck? They're looking for some inspiration. Do you have some advice for somebody in that situation?
Yeah, I mean, my bias, of course, is going to be let's take a look at your numbers. Let's see about implementing profit first, because I find a lot of times that chiropractors can sort of reach a plateau where it's like it's status quo. They know that they're generating good money and they're bringing home money to themselves, but they're just a little bit disconnected with how all those pieces of money fit together. So I think it was vitally important for me almost to step out of the profession and find this method that comes from, a business background, not necessarily just focusing on things like PVA in your collection ratio and things like that are more chiropractic specific. Okay, let's look at this more from an entrepreneur viewpoint. And look at, implementing profit first, because I think, it just makes it so abundantly clear, what you are, paying yourself, compensating yourself, making your business lean. And then, we have to think, what is your exit strategy? What's your retirement plan? Because practices, let's be honest, practices are not selling, like they used to 10, 20 years ago. So that can't be your only retirement plan, right? We need to have all those steps in line so that we make sure that you're planning appropriate for that. And that may mean, you hire an associate or you bring on a partner or things like that come from knowing the numbers.
Yeah, I really like that. It's kind of like a realigning your vision for the future. I think maybe we can get into practice 10, 15 years and lose sight of, what's our new vision, because we're still just living the vision that we had when we graduated or a few years after that. So I like that. So can you tell us maybe about something that you guys have worked through or overcome in your practice since you guys have been in practice about 10 years now? What's one thing you guys have come up against and your challenge that you work through?
Yeah, I think that one of the challenges that, I found over the years was this idea of wanting to freshen up the practice, not necessarily, from a decor perspective, but, just trying not to get caught in that every day feels like the same thing sort of thing. So it's for me, I felt like I had breaks in the practice, when I would go out on maternity leave and I'd come back with something renewed and focused. And it's okay, from marketing the acupuncture standpoint, and then, moving more into nutrition. And, what I realize now is that sort of made me kind of all over the place, right? Because it's at one point in time, when I was pregnant, maybe I was trying to market more towards other prenatal moms and babies and pediatric practice. But then once I moved more towards nutrition, even though my goal wasn't necessarily weight loss, it's overall health, that was the sort of public perception of, I was just doing that, to help people lose weight. So I think that trying to meter my passions and, not always acting like we're trying to reinvent ourselves, but then making it, that we're a resource for the community and they just have to know, who to refer to us or know exactly what we do. And it's if every year there's something new and shiny, it's hard for people to know that. But I can say after, actually being away from our first practice, I still on a weekly basis get either calls or messages or emails from somebody of our patient base that's looking for a provider that was like us, because our office was so unique and we offered different services. Unfortunately, there really aren't a lot of people that I can point to and say, here's, the referral for this person that would do it exactly the way that I did it. And of course, I know that happens in other professions too, but I think that's been a big struggle. I miss what we had, definitely, but we definitely enjoy where we are now in our careers too.
Yeah, I think that's very similar for us because we started our practice in Colorado and we worked, and it was kind of smaller town. We were really close to Denver and Boulder, but we were in our own small town, and you become such a part of it, which is so awesome. But then it's hard when you move away, and all of those great relationships that you build to build the practice become so important to you, and you really care about them. So I love that you guys had that experience, that you started your practice and just was such a big part of the community. Because I think that's what it takes, is you really have to make yourself that person in the community to grow the practice. You have to get to know people and your patients and give them great care in order to build. So that's so nice. What's a favorite book of yours or that you would recommend? Maybe other than Profit First.
Okay, I can't say Profit First. Okay, fine. No, I actually, it's not going to be a chiropractic book. I really like, do you know Mel Robbins, the 5-second rule? I really feel it's an action-packed book, like meaning it's short and it's compact. But I think that was another kind of turning point for me is just finding inspiration in other stories. I mean, everybody has moments, in their life or their career where they feel like they've hit rock bottom, and it's not necessarily perceived by anybody else in the outside world, but you are feeling like you've lost your motivation or your inspiration. And so I think Mel Robbins, that 5-second rule book really is one of my top favorites.
Okay, I haven't read it, but I do know who she is. I follow her on Instagram, and I know the premise of the book, so I'll have to check that out. Thank you. What is the best business advice that you've ever received?
I think that, I can't necessarily, link this back to one person in particular, but, maybe just more evidence of my journey is like, you have to be yourself. You can't try to be, anybody else that anyone tells you that you should be in practice. I actually had the opportunity and the pleasure and the honor of being asked to give Logan's commencement address back in August of 2019. So, I'd only been out of school for 8 years, and it just seemed like how was I qualified to be on that stage, right? But I have done many different things in my career. But the take-home message of the speech that I gave was like, you just have to be you. You have to be honest, with yourself and with your patients, and create the life that you want. You can't. And I gave this example. You can't join a management company that tells you, to go and deliver, sheet cakes to businesses to drum up business. If like your heart and your passion is whole food nutrition, which is me, that's like my story, right? So you just have to find things that are aligned and that are congruent that make sense to you.
I love that. I love that everything is all about being authentic and being your true self. And I think when you're in practice, if you want to create a place that you love to be and enjoy going to every day, that being your authentic self and attracting those people that are attracted to who you are makes that environment so much more enjoyable. So what's the best way for people to connect with you?
Yeah, I'm fairly active on Instagram. My handle is at Dr. Holly A. Tucker. I have, a blog series and some stuff. A lot of content I'm putting out right now in regards to Profit First. But yeah, I'm pretty reachable on there.
Okay, and that just reminded me, you have a podcast too. Let's talk about that for a minute. What's the name of your podcast?
Oh, yeah. Yeah, our podcast is the ChiroMom Podcast. So it's me and my two biz besties, Dr. Sarah Radabaugh and Dr. Goldie Jacquemains. We were mastermind sisters a few years ago. Actually that core group that implemented Profit First together, and even after, the structure of the mastermind had ended, we just continued, to meet monthly, over the last 4 years. And we met in person. We got to meet in person back in 2019 because we're all over the U.S. and we came from different chiropractic backgrounds and schools and stuff. So the idea just kind of landed in our laps last year. Like, hey, let's take some of these conversations that we have and just put them on a podcast and see where it goes. So it's called ChiroMom because that's what we are. But our audience really is for any busy mom that's trying to manage life and staying healthy and possibly running a business and friendships and things like that. So it's conversational. We're having a lot of fun with it.
I love that. Might be a good thing to recommend to patients that are moms or new moms looking for to listen to something like that. So I love that. Well, thank you so much for being on the podcast today. I appreciate you sharing your journey, your story, and connecting with you. So thank you for coming on.
Yes, thank you so much, Dr. Haley.
If you enjoyed this podcast episode, please share it with your friends on Instagram and Facebook. And for those of you who are already subscribers, we really appreciate it. Thanks for the reviews. We love reading those and knowing that you're loving the podcast. If you're looking for more tips and inspiration, be sure to check us out at lifestylepracticebuilders.com or join our business and marketing Facebook group for chiropractors at facebook.com/group/lifestylepractice.